In insurance, there are three broad risks which we cover. Risk of dying early, risk of living too long, and risk of living with morbidity.
Caregiving is not always stress. It is a very self-satisfying effort which one makes, which let them feel that they are doing something good in their life.
Basically, caring of a caregiver is super important.
Very important. And I think the one emphasis of Caregivers Asha Society is to develop a system where we care for the caregivers.
As a child, my mother used to tell me a lot, and I now at this age tell my team members, life is a cruel teacher, gives you the examination first and teaches you later. So a lot of things suddenly happen, sir. Hi everyone, welcome to another episode of Life Uncovered with Vaibhav. आज की story is very special. I've shared it with a few people, but not everyone who's watching this is aware of this. This is May 1998. I had severe headache and Papa, being a doctor, took me to an optho. पहला thought ये होता है कि कॉलेज में पढ़ाई के चक्कर में या रात को लेट नाइट पढ़ने के चक्कर में शायद चश्मे लग गए हों. But eyesight was absolutely normal, and because this is 98 and I'm sitting in 25, अभी भी आँखें ठीक हैं, तो उस समय आँख की कोई प्रॉब्लम नहीं थी. And our guest tonight, he is one of the most renowned doctors of Jodhpur and family friend also. So पापा ने कहा चलो अरविंद अंकल के यहाँ चलते हैं, तो उनके यहाँ गए and he immediately spotted a few things by just touching and sensing and taking the symptoms, and ordered certain medical tests which naturally for a normal person would not have happened, only because coming from a doctor's family and reaching the doctor's place immediately was a saving grace. I did not have full symptoms, but the report came out with malaria falciparum, which is known as cerebral malaria. And 98 malaria falciparum was extremely deadly, and which led to also typhoid. So it didn't lead to typhoid, but typhoid also came in the second blood test, with Vidal being, I don't know, sir, positive या जो भी number होता है as a non-doctor. But it was there, and I was in a severely sick condition. The reason I'm sharing all this is even during that time, and sir being extremely busy, and Jodhpur was एक रोड है खतरनाक पुलिया. अगर बारिश होती थी तो जोधपुर would be cut into two sections and लोग इधर से उधर नहीं हो पाते थे. But उस बारिश में भी sir came to visit me, and basically I'm alive largely because of whatever happened at home. And with sir, the reason I'm sharing is it's all about empathy, caregiving, and the feeling of giving back to the society irrespective of what the situation is. And that's, I think, the reason it's led to where we are today, sir. With sir making Caregivers Asha Society. Welcome to the thing, sir.
Thank you, Vaibhav. Thank you very much for the kind words. And I'm really moved with your gesture. And it's my pleasure today to share our journey of the Caregivers Asha Society. As you correctly mentioned, caregiving is a very important aspect of life which touches everybody sometime in their life.
So in fact, coming from an absolutely non-doctor myself, but doctor's family, and having spent my entire childhood within the hospital premise, one thing is everyone who does MBBS, but empathy, caregiving is way more important. And my father used to say many times that operations is other post-operative care is what differentiates between the correct treatment and not. So after touching so many lives throughout the thing, how did this idea of this society come to you, sir?
You correctly mentioned, as your Papa had already shared, in our practice we have realized the caregiving by the family is the most important component of recovery of the patient, and they contribute a lot to the health care. I realized personally that when you become caregiver, you need to have some knowledge to take care of somebody at home, and with this feeling only, we started this organization. This is a non-profit organization which was established in 2019. Asha being my wife, who devoted her life to teaching and healing all throughout her life, was the source of inspiration for establishing this particular society, where we are trying to empower caregivers with knowledge, skills, and dignity.
But you also have an app, which is Care Asha app. I would love to know more, and at least our viewers across the country can utilize it.
Care Asha app is an important component of Caregivers Asha Society's contribution. This is an innovative app which provides all the information one would need to take care of somebody at home. Because we have realized that as a caregiver, you need to know several things, like issues may be related with behavioral disturbances or fall prevention, may it be a first aid or handling emergencies. So what a caregiver at family, in the family should know is available in this particular app. We are happy to tell that this is an AI enabled app.
Oh, wow.
Where with the AI chatbot, somebody can try and find a focused information also. They can maintain their own records in this particular app and share it with anyone they wish to. Along with this, they can assess their own health also using this particular app. In the app, we have tried to include stress management. Several techniques of stress management have been placed. Several videos, demonstration videos are there. By seeing them itself, one could learn about caregiving. All this is free. The app is available both on Android and iOS platforms, and I personally feel that this app is going to be useful for anyone who is caring for somebody at home. This app at present is available in 4 languages. We have English, Hindi, Tamil and Bangla version. Already we are working on several other languages of our country and also abroad.
Wow.
So this app, I hope, is going to be an important tool for everybody. I'm happy to tell that till now, this app has been downloaded in more than 38 countries.
Oh, fantastic.
Across the world. And the feedback which we have received from those who have used it has been quite encouraging, and it reinforces our conviction, because I had one housewife, she was telling that about her mother-in-law who is suffering from dementia, and they are somewhere in Gurgaon, and she called and told me that using the app, she was aware that what is going to happen with this particular patient, her mother-in-law, and whenever they went to the doctor, they were prepared to question them or get their queries clarified by you having this information from the app itself.
Wow.
So I feel that this app is an important thing, available freely to everyone, and we will be happy that people use it. Somebody can connect with the expert also through the app.
Oh, wow.
So if they have any query, if they have any question, they can definitely ask it through the app, and our team is there available who would respond quickly to their queries.
Otherwise, the AI is also there. So
yeah,
AI plus human is there.
Yes.
That's fantastic. So I've noted down few things which I'm just going to recap, which is for our viewers is 4 languages currently, many more to come. Already 38 countries are benefiting, and you shared one story, but I'm sure there are a lot of other stories of people getting help. What you touched upon is so important, sir. Stress impacts people, and stress management is required, especially for caregivers. And one story I will add over here, sir. We always used to, for a very long time, think, and a lot of viewers may be thinking that caregiving is only for elders. But I get so many cases of people where children are born with issues, or at least are suddenly detected of cancer, and a lot of caregiving is required. And caregiving at one side and stress on the other side. So this app, I'm sure, is a blessing for thousands, if not lakhs already, and I'm sure it is for millions and millions across the world. So this, wouldn't it be like a digital partner for someone in a situation जब किसी को problem है और उसके पास एक partner है to share the stress? मेरे क्या thoughts हैं आप इसमें?
I think you have correctly pointed out that caregiving is not exclusively for the older people.
Yeah.
I like to quote Rosalynn Carter, the first lady of USA, Jimmy Carter's wife.
Right.
She said that there are only 4 kinds of people in the world.
Yeah.
One who are caregivers, the other who were caregivers, third who will be caregivers, and fourth who will need care. So in everybody's life, care is going to be an important aspect. And we see Care Asha app as a digital partner for those caregivers. Stress management is a very important aspect. There is a hidden stress with the caregiving, which is always there. It may be physical, social, or financial, whatever form it takes, but they need support. There is one more aspect which I like to mention at this particular point. Caregiving is not always stress. It is a very self-satisfying effort which one makes, which let them feel that they are doing something good in the life. Because if somebody is taking care of someone in the family, they realize that they are developing a good bondage with them.
Correct.
They are learning from them.
Correct.
And secondly, there is a sense of satisfaction inside also that, okay, I did something for my grandparents, or I did something for my mother-in-law. So that sense of feeling is also there. The only thing which I have realized all these years, they just need some recognition. They are happy in doing their tasks, but most of the time in the society, this recognition is missing. And many times, most of my patients, attendants, they would come, caregivers would come and tell that, okay, they are happy in doing all this, but in family, nobody realizes that what effort I am putting in.
Correct.
So recognition is one important thing. So stress is there, and stress management has to be there. And our app has got certain simpler techniques included for stress management.
Very good. So in continuation, we had read that you have partnered with Asian Center for Medical Education, Research and Innovation. Can you share something more on that?
Yeah, with the Asian Center for Medical Education, Research and Innovation, we have established an ACMERI Asha Care Skill Institute at Jodhpur. Now, this particular institute is unique, I would say. It's a unique effort. It's a simple but unique effort where we have tried to create an establishment where anybody could walk in and learn about caregiving. Suddenly, if somebody finds some problem at home and has, because most of the time we are turned caregiver overnight.
Correct.
Somebody got stroke in the family and the next moment you are caregiver. Or somebody has got a fracture and is bedridden, you are caregiver. You will turn into a caregiver. So we have kept this provision that anybody can walk in to learn about caregiving skills. Secondly, we have a formalized caregiving course also. The healthcare sector skill center under the Skill India program has devised a program for caregivers. So our center is equipped to provide that particular caregiving training also. If somebody is keen to take it as a profession, they could come down and learn about all these things, all these skills to be turned as a professional caregiver also.
Right. So in fact, when you said sudden changes, as a child, my mother used to tell me a lot, and I now at this age tell my team members, life is a cruel teacher, gives you the examination first and teaches you later. So a lot of things suddenly happen, sir.
Yes, yeah, exactly.
Sorry.
Because yeah, exactly. I think we get exams first.
Exactly.
And then we learn the answers.
We learn the answers. So is this course available online also if somebody is in, let's say, Bombay,
yes,
Bangalore?
Yeah, I think you have raised a very important issue, and we also realized it because we got queries from Bangalore, from Delhi about the caregiving course. So what we have done is we have developed an online caregivers course.
Oh, wow.
That course includes all the aspects of caregiving which are needed to be taught to somebody. We visualize it that it would be about for 6 weeks that somebody will have to learn about it.
Right.
And along with the theoretical knowledge and information which we will be providing, we will ask them to get in touch with some practical learning into some institutions. So this online caregiver course is there now with our center. We are in process of having an impact study of that online caregiver course also, so as to see what is the impact of this particular course. And last week only, I would say last week of October, European WHO region started an online course on family caregivers.
Oh, wow.
Our course is having a syllabus which is more expanded on that.
Right.
But they have also realized that online caregiving course training is important.
It is super. In fact, yesterday during the cancer event, I was reading about the life expectancy. In 1947, Indian life expectancy was 32. When I started my corporate career in insurance, our life expectancy was around 62, 63. Today it's around 72, 73. So as life expectancy goes up, therefore, even if there are no ailments with aging population, caregiving is a must.
Yes, this is the important part which we have all to realize that with the population aging, the demand for care is going to increase.
Yes.
Now, in addition to increased life expectancy, what has happened that the fertility rate has come down. Now you have got fewer children to take care of the parents or grandparents.
Correct.
As compared to the past.
Yes.
So now the fertility rate has gone down below 2 also. So that makes a situation where we'll have fewer people available for caregiving. And I think this is one area where we need to think seriously and plan seriously so that we can have a proper long-term care of the older people.
That's so true, so true. In fact, I'm sure there should be things that we should be doing in school education for this. What are your thoughts on that?
Yes, I think you have really raised a very pertinent issue. What I realized that during our school education, nowhere there is a subject which teaches what happens with aging to a human being. So what are the changes which are occurring in the older adults? What would be the needs of care for that particular person? And what are the benefits of caregiving? They are not taught to the students. At our society, we have started a project which we have labeled as a Future Caregivers Initiative, wherein we are going to schools, sensitizing those kids primarily from class 8 to 12, because we feel that at least a 12-year-old plus student is one who would learn about it.
Right.
We give them the issues of old age, values of caregiving, and
Right.
teach them empathy with interesting simulation exercises, which tells them that how would their grandparent would be viewing by using frosted glasses or using devices to with the gloves. How would you button your shirts or so, because dexterity of hand is lost.
Correct.
So this particular part is taught to them, and we also give them a young caregiver pledge also, which tells them that they would respect elders and care with kindness. So this particular aspect of sensitization of a school student is very important, and our society is aggressively working on this. We will love if this particular task is taken over by many, so that this reaches most of the schools and most of the students.
Absolutely. In fact, sir, in insurance, there are 3 broad risks which we cover: risk of dying early, risk of living too long, and risk of living with morbidity. And I think risk of dying early, if kept aside, the other 2 risks absolutely need caregiving: risk of living long and risk of living with morbidity. And I think if we can, maybe not immediately long term, do something within the school premises for both these things for a long term.
I think yes, the school children need to be involved for this particular aspect. When you mentioned about insurance, I feel that we are still having a vacuum about long-term care insurance,
Absolutely.
which is existing in Japan, Germany, where somebody can insure themselves about the care they would be receiving in the old age when they need it. So this is one area where we feel that if we have some homework and we assure some with the insurance people that they would be cared for during the old age, it would be worthwhile and would be a great help to people. Basically.
What a brilliant idea. We don't have in India, no one is doing, but we will definitely try to work on it. I've made a note. It is a brilliant idea, because people are at most only creating money for pension, but how do you utilize that pension is super important.
Yeah.
Absolutely. So also you are a member of WHO, a representative from India. Can you share something more? It was a very proud feeling when we all read here, but our viewers would love to know.
I think I'm really fortunate that all these years we have been working with the WHO for the aging issues, which started long back in 2002 or so onwards. We have been working with this, and now with our society being there, we became a part of WHO Civil Society Commission.
Right.
WHO is right now trying to connect with non-profit organizations and try to learn and work with them. So, Civil Society or Commission's steering committee, the Caregivers Asha Society is a member of steering committee, and I have the privilege to represent that over there.
Right.
We are member of Global Alliance for Care. This is an organization which of UN Women.
Okay.
UN Women is an organization of United Nations which looks after for the well-being of women. Caregiving being primarily a gender specific, or with more and more women are involved. That's why this Global Alliance for Care is a part of that UN Women. And also we had the privilege last year in September to be called to attend UN Summit of the Future at the United Nations General Assembly and represent our cause of caregiving, particularly with reference to scenario in India. And there also we advocated that caregiving should become a part of universal health coverage, where the long-term care is looked after. So that is how we are trying to work on this, and our work for the research also continues with the Karolinska Institute Sweden, where we are also part of their Indo-Swedish dementia caregiving program, and with AIMS Jodhpur and SNMC Jodhpur also we are trying to work with them.
So I'll just pause here for a second and for the viewers share a very interesting story. Last time I'd met with you on the Swiss watch on the railway stations. I will not disclose the story because it will go into a different dimension, but anyone who's viewing should take a pause here or maybe later after the video. Google it. It's a wonderful story how all the clocks on the Swiss railway station are working. I don't want to disclose or spoil this thing, but it is a must know fact. On that note, sir, slightly away, but any story that you have from your life or any story that comes to your mind always when it is about caregiving?
I tell you that in my practice, all these 46, 47 years of practice, I've always been watching caregivers make difference in the life of my patients. I am reminded of a young widow who was with her mother. Mother was obese, paralyzed lady. She took care of her for more than 23 years without having any bad sore, or because that's a common thing,
Right.
or any nutritional issue for that her mother.
Wow.
This was in sometime in 2000. It all started from 85, and I was seeing her almost up to 2008 or so. I just said to her that hats off to your care, that your mother has been alive all these years with your care also. But then the challenges which are there with them, I narrate you about another housewife. I'll just say it's Mrs. B.
Yeah.
She left her job. She was having a good government job to care for her mother-in-law with dementia.
Whoa.
She's still taking care of her.
Oh.
So she left that job because she couldn't continue that. So all her plans in life of her progress, career, etc., they were shelved. So we all realized that caregiving has its own issues. And when I talk to her, she just says that I am happy with my role, but I need some recognition.
Yes.
There are times when they are exhausted. They need respite care also. Some way of recognizing and some support is needed for them.
Basically, caring of a caregiver is super
Is
important.
very important. And I think the one emphasis of Caregivers Asha Society is to develop a system where we care for the caregivers.
Super duper important, sir. So going ahead, any plans of extending it beyond Jodhpur to other cities? What's the future plan?
Yeah, I think we want, as I mentioned, to spread it as much as possible. As I mentioned that this institute which we have created, Acmery Asha Care Skill Institute, is in a very humble and a doable beginning.
Right.
I see that we can establish this type of centers in various cities across our state itself also. That is one, even from Jaipur or other cities we can go. In addition to this, we got a contact from Nepal.
Yeah.
The Genetic Society of Nepal, they contacted us, and they are keen to develop such setups over there. So we are trying to collaborate with them and to guide them how to develop this, because our objective is that this message spreads as much as possible. Similarly, recently we conducted a training of the training program for the genetic caregivers. So we wanted to train trainers who
Right.
would train caregivers in their place. This was an online program. We got almost 200 registrations, 38 from Indonesia,
Right.
8 from Nepal, rest from across the country, the India itself. So we are trying to connect with all of them and try and encouraging them to establish similar type of setups in those places. That is one thing. Second, we want them to adopt Care Asha app, and if we are open, if they translate it, we are going to augment our app itself also. And third thing is that we want them to join us in advocacy for the caregivers.
Perfect. In fact, when I hear all these things, 3 words that come to my mind are health, job being created, and empathy. Empathy for me is actually the biggest between the 3. But what are your, if you have to frame it in one sentence, is it the same or is it?
Yeah, I think, this is what we are trying to do. And I feel that if we can develop Jodhpur as a city of compassionate care, where everyone is cared for with dignity, older people they would live, and caregivers are also supported, that will be our dream.
Done. So before we close, if I am with you, I don't want to leave without any discussion around heart and heart's well-being and things like that. Any thoughts, if one has to make sure for our stress being reduced and other things, caregiver, how does he or she take care of his or her heart and well-being of the heart? What are the things they should keep in mind?
Yes, very important thing, because caregivers most of the time they ignore their health. When the patients come to us with the caregiver, I would ask them that, okay, you are hypertensive, are you taking your drugs or not? Sir, I am all right, I'll come to you sometime later. We'll talk about that sometime later. They usually ignore their health.
Correct.
That is not good. That is not correct. I think when we we take a flight, we are first taught that, okay, first put your mask on and then take care of others.
Correct.
So I tell them, and I really would ask all caregivers to realize that until unless they are healthy, they will not be able to take care of others' health. So what they need to do is that they need to have a proper rest, a proper diet, because the stress is already there.
Right.
We do not want to add diet in like fatty meals, etc., to add to their problems of creating heart disease or hypertension or so. Then they take care of having their regular checkups for blood sugar or blood pressure monitoring. And if they have got any of these things, they should take care that they are under control or they are being treated properly also. So taking care of their own health is equally important, and they should not feel ashamed of mentioning about their illness, because they are out of fear or out of shame that they will not share this. They should rather be vocal in expressing this, and it is needed that we also try to take care of these caregivers' health.
After what you have said, just one question out of curiosity, because I've heard a lot of people crib about it, but I have a very strong belief, again coming from a doctor's family and someone who understands medicine to a certain extent. A lot of viewers of ours and a lot of customers I talk to, people I talk to, say that yes, I'm on X medicine for, let's say, diabetes, hypertension or any lifestyle ailment, but I will take it. How important is it to take all these medicines on the prescribed time and not miss out on those timings?
I think management of high blood pressure, diabetes, it needs, or for that matter any other illness, these are the common illnesses which I mentioned.
Right.
There is a need to adhere to the prescription. There is a reason for it, and there is a reason for it because we do not want an erratic drug consumption creates problem for you.
Correct.
Okay, so it is important to adhere to your prescription. Very important.
Thanks a lot, because coming in from a doctor makes sense. If I would say, people would still ignore, but it's very important. Thanks a lot, sir, for this session. It's been super helpful.
I think it has been my privilege today to give voice to our feelings and for our mission that we want to support caregivers, and let all caregivers remember that they are not alone. Caregivers Asha Society is there to support them and try and develop a future which is going to be good for the society at large.
Towards the end, I would like to say their website is caregiversashasociety.com. The app is Care Asha. Please download the app. You can visit the website. In the comments after watching the video, you can leave comments in the box if you want to ask any questions specifically for sir on caregiving, or if you have any stories also, would love to hear your stories. We would love to share it with sir after the video. But thanks a lot for your time, sir. And as INCA, whatever we can do in long term, would love to, because a lot of things are very similar. We also believe in education, caring, empathy, but in whatever way possible. Thanks a lot for your time, sir.
It has been my pleasure and privilege today, and I'm sure that with the association with INCA, our cause will get a boost, and definitely we will like to hear sometime in future about the long-term care insurance and other products.
Absolutely. Thanks a lot, sir.
Thank you. Thank you very much.